We're going to be seeing Amanda today. She is a 25-year-old female who just gave birth to a baby boy. He has neonatal abstinence syndrome. Amanda has a history of alcohol abuse, depression, and opioid abuse related to a traumatic car accident that she had 7 years ago. She currently lives with her boyfriend, which is the baby's father. She dropped out of high school after the car accident and never received her GED. She is currently unemployed at this point. So today I'm going to be going over with her what NAS is, some risk factors, ways to calm the baby when he is withdrawing, and expected symptoms to report, and we'll see if she has any questions. Hi Amanda, my name is Nikki. I'm going to be your nurse today. Can I go ahead and get your name and date of birth, please?
Yeah, my name is Amanda. Date of birth is 8/14/97.
Great, thank you, Amanda. So I understand you gave birth yesterday to a baby boy. Congratulations.
Thank you.
So I know Dr. Smirka talked to you a little bit yesterday about your baby and about neonatal abstinence syndrome. What can you tell me about that?
So yesterday I was pretty overwhelmed. What I remember, it's something about I took Oxy when I was pregnant with him, and so that's affecting him in some way. And I'll see signs and symptoms, but I don't really know what that means yet.
Yeah, you're right. I understand you had some chronic back pain and you were using some medications. So basically what's happening is those medications, they're called opioids, and your baby, those opioids cross the placenta and go into the bloodstream, and so that's why your baby has neonatal abstinence syndrome. So he's going to be experiencing some withdrawal symptoms from those medications. What else can you tell me about it?
So I know that there are some symptoms that are going to be really bad that I'll need to be more concerned about than others. But like you said, it's because I did opioids and it crossed through the placenta when he was in my belly.
You're absolutely right. So we'll go over some signs and symptoms of what you can expect with Mitchell. We'll also go over what symptoms when you go home that you should be reporting back to your healthcare provider. And also ways that you can calm your baby at home. I understand he's going to be here for a while, but when you take him home, it will be very important for you to understand what signs and symptoms to look out for and when to call the healthcare provider, and just ways to just keep him comfortable while he's at home. How does that sound?
Good. I was really worried about knowing how to take care of him because I did use opioids and kind of as a coping mechanism, and the thought of the fact that I already hurt my baby when he was still in my belly is really scary for me.
Yeah, so the opioids, would be that like oxycodone, morphine, codeine. Those things can do that. So we'll go over those things.
Okay, thank you.
You're welcome. So Amanda, I have this brochure regarding neonatal abstinence syndrome, and I will definitely send you home with this. It has some really great information for you. I know we talked about going over some signs and symptoms that you can expect with Mitchell. So let's just go over a few of those. You might find that he'll have some trouble sleeping. That's not uncommon with a baby with NAS, which also kind of goes along with the irritability. He could be vigorous or excessive sucking. So are you planning to breastfeed?
That's what I want to try first, yeah.
Okay, and you're no longer taking the medications?
No.
Okay, so perfect. You will notice if he starts vigorously sucking and your nipples start getting dry and cracked and that kind of thing, that's also a sign of vigorous sucking. You'll notice that, okay? He could be tremors, he could be shaking a little bit, and again, these are symptoms that can last for a while, so something you might want to be looking out for. Muscle tension, it's just, with the muscle tension, it's also another reason why we try to swaddle them to keep their limbs and everything nice and tight, but you can expect some muscle tension and tightness in Mitchell. Sweating, if you start to see him sweating, that's common with a baby with NAS. Diarrhea can be very common, as well as stuffy nose. So some of these may seem like they're kind of common to any baby, but you'll get to know your baby and your baby's cues, and you'll know when something starts to be different. So obviously sweating, you know, you wouldn't normally see that in a normal infant. So there are definitely some things here that you'll want to be looking out for. So
yeah, so I know what the doctor talked to me about a little bit, and then what you just said, like the trouble sleeping and the irritability is common, and swaddling them really tight will help with that. But one of the things I was kind of concerned about was the sweating. And I know he mentioned something about taking my baby's temperature, but I don't remember what the temperature was that I should be concerned about.
I'm so glad you asked that, Amanda. I was going to talk to you about that. So typically if he has a temperature of 99.5 or lower than 97.5, that's to be concerned about. And where you're going to want to take that temperature is an axilla temperature. You know, you put it right up underneath the crease of his arm, and you're going to hold it there. Okay, so that would be the appropriate place for you to be taking that temperature. But I'm really glad you asked that. That's good of you to check that out.
Yeah, so is that something that I would need to do like every day just to be safe?
Yeah, I would be doing that every day, and I would be charting it just to make sure that he's within a normal limit.
Yeah, that's a lot less stressful than just taking it whenever I feel like I might need to. Because what if I don't take it when I should have?
Exactly. So do you have any other concerns, Amanda?
Yeah, so I know you said like the vigorous sucking, and what if I were to bottle feed? Because I don't want to get hurt. I'd rather just bottle feed and avoid all of that. So how will I tell if he's not sucking if it's on a bottle?
You'll typically notice that he'll start to be really gassy because he's taking in a lot of air.
Okay, so does gassiness kind of go with like the diarrhea, or how will that be different?
So the diarrhea is actually going to look a little different in terms of, I shouldn't say look a little different, I should say you'll notice a difference in the number of stools.
Yeah, so I know that you said about the temperature, and that's something I can just look at a number and know that I need to be concerned and call the doctor. And the diarrhea is going to look different based on this is normal and this is not normal. And then same thing with the sucking. That's something I can feel and know for certain to be concerned about. But what are ways that I can calm my baby down and help him if he's just crying and irritated?
Actually, I'm really glad you asked that. There's been some really fantastic evidence-based practice that's come out about music therapy. So something that we can try while you're here, if you're interested, is we can actually record your voice singing some lullabies. And what we'll do is we will actually play them for Mitchell while he's here, get him adapted to the environment, and that will help calm him down, so that when you go home, and when he goes home, it'll help him transition a little bit better to home life, and hopefully that will help him be a little bit more calm.
Yeah, I've read an article about that the doctor shared with me, and whenever I was pregnant with him, I would actually sing to him, and that's when he would kick and I would feel him. So that's definitely something I want to try.
A couple other things that you might want to do is, did they talk to you about kangaroo care at all?
All they said was kangaroo care, but they didn't really explain what it was.
Okay, so kangaroo care is basically a tight skin-to-skin contact with your baby. And typically with a baby that has NAS, you want to do that in a calm, kind of a dim environment. It's not good for Mitchell to be overstimulated. So being able to provide a calm, quiet environment and provide some skin-to-skin contact with him should be very soothing for him. So I would definitely recommend that as well.
Yeah, I think the only other thing I'm worried about is kind of like learning how to swaddle him right. Is that something you could show me how to do?
Yes, absolutely. We can do that before we discharge you home for sure.
Okay, great.
So Amanda, now that Mitchell is crying, now's a good time to show you how to swaddle your baby, okay? So I'm going to go ahead and place this blanket here, and you can go ahead and place Mitchell down in the blanket.
Just in the middle?
Actually, you'll want to move him up so his head's up above that there. Perfect. So go ahead and grab that side, and then tuck it. Yep, you want to nice and tight, and then tuck it underneath his body so it's nice and tight. Okay? Then you want to bring up this bottom part over. Exactly. And now you're going to bring that and fold it over his body and tuck it underneath his body. So now you can pick him up. Now that he's all nice and swaddled and nice and tight.
Oh, that really does work.
It does.
Thank you.
He enjoys that.
Yeah.